Hey guys, welcome to Tuberculosis in Depth. My name is Kurt.
And my name is Nyeleak. Today we'll be informing you about TB and the impact it has around the world.
So tuberculosis, or TB, is an infection caused by the microorganism bacterium Mycobacterium tuberculosis. TB typically affects the lungs but can spread via the blood and affect a person's bones, brain, urinary tract and sexual organs, the intestines and skin. TB is spread amongst person to person through microscopic droplets containing infectious agents in the air. This can occur when a person with the untreated active form of TB talks, breathes, coughs or sneezes, etc. Direct UV light quickly kills the airborne TB bacteria, but they can survive in the dark for several hours. Looking at this diagram, we can notice the stages of TB. Start with transmission, which, unless previously vaccinated against, develops into latent infection. In this condition, you have a TB infection, but the bacteria in your body remains in an inactive state, causing no symptoms and remaining non-contagious. A person's immune system is generally strong enough to fight the infection and keep it from becoming any more severe. From here, the infection can be treated, or it can progress to active TB if the immune system is incapable of continuing the fight, which is far more serious. This condition can make a person sick and it can spread to others. Active TB can occur within weeks of infection, or it can occur years later. If left untreated, active TB can be deadly. Symptoms of TB include persistent coughing, coughing up blood, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills and/or loss of appetite. There are several methods in order to diagnose TB. Simple methods for diagnosis include a patient's medical history, where a doctor can check if a patient has been previously or are currently reported as being infected. A doctor may also just check the sound of a person's breathing through a stethoscope to notice any obscurities or differences. The most commonly used diagnostic tool for TB is a skin test, where an injection is made below the skin in the inside of a person's forearm. If a hard, raised red bump results, it means you are likely to have TB infection. However, due to reliability issues, other further tests exist, including blood tests, which is sophisticated technology to measure a person's immune system reaction to TB bacteria, imaging tests, so if a positive skin test returns, a chest X-ray or CT scan is generally ordered. This can help to show white spots in your lungs where the immune system has walled off TB bacteria, or it may reveal changes to the lungs caused by active TB. And finally, sputum tests. If imaging tests show signs of TB, samples of sputum or coughed up saliva and mucus may be taken to test for TB bacteria. Sputum tests are handy to test for drug-resistant strains of TB and help doctors choose medications that are most likely to work on the individual patient. According to the Australian Department of Health, TB treatment and management involves three main protocols: case treatment, education, and isolation and restriction. For case treatment, treating physicians are responsible for implementing appropriate treatment strategies with support provided by public health and TB services. This sort of treatment is provided to minimise the development of initial or further drug resistance, the recurrence of disease related to non-adherence or inappropriate TB treatment, to assist the patient in achieving cure, and to document successful treatment completion. Antibiotic therapy for TB takes at least 6 to 9 months, but depending on a person's age, overall health, possible drug resistance, the form of TB, whether it's latent or active, and the infection's location in the body, the type of drug and length of treatment can vary. For education, the key is to inform patients and household contacts about the disease process and transmission. In this process, it is important to reinforce further information about medications and their possible side effects, and emphasise that it is a curable, preventable disease. For isolation and restriction, patients with suspected or confirmed TB are to be isolated from the general public as much as possible as to reduce the spread. In order to treat TB, a patient will need to take medication, which includes a number of possible side effects to the body, including nausea or vomiting, loss of appetite, a yellow colour to your skin or jaundice, dark urine, and a fever that lasts 3 or more days and has no obvious cause.
Hi guys, today I'm going to be informing you about the impact of TB globally. The largest TB cases occur in Southeast Asia and Western Pacific regions. accounting for 50% of new cases globally. The World Health Organization have stated the most severe burden is found in Africa, which have 281 cases per 100,000 population in 2014, compared with a global average of 133. Additionally, in 2014, the 80% of tuberculosis cases reported came from countries with the largest incident cases, such as India, Indonesia, Nigeria, Pakistan, and People's Republic of China. And so now look at this picture. We can see the TB situation as a whole. In 2013, 9 million people around the world became sick with TB disease. As a result, there were 1.5 million TB-related deaths worldwide. Furthermore, 37 million lives were saved through effective treatment between the years of 2000 and 2003, with a 45% decline in mortality rate since 1990. Furthermore, just some further facts. TB is one of the top 5 killers of women aged 20 to 59 years. Additionally, 480,000 women died from TB in 2014, including 140 deaths among women who were HIV positive. Also, 890,000 men died from TB, and 5.4 million fell ill with the disease. An estimated 1 million children became ill with TB also, and 140,000 children died of TB in 2014. Now I'm going to talk to you guys about the impact of TB in Australia. In Australia, TB is very low and stable, with only 6.8 and 5.8 cases per 100,000 population for 1990 and 2012. Most TB cases occur from recent immigrants from countries where there's high TB cases. In Australia, there were 538 cases of TB in children between 2003 and 2012. The average annual notification rate for children was 1.31 cases per 100,000 children population, ranging from 0.92 in 2003 to 1.65 per 100,000 children in 2006. Furthermore, anyone can contract TB, but there are certain risk factors which can increase your risk of the disease. These include a weak immune system, which is often able to combat TB bacteria successfully. However, a number of diseases and medication can act to weaken a person's immune system. For example, HIV, AIDS, diabetes, certain cancer, as well as a cancer treatment like chemotherapy, substance abuse, traveling or living in certain area. Also, people with low income may lack access to medical care require to diagnose their TB, therefore they might have TB. A person living or working in a certain environment could expose them to having TB. Also, things like immigration centers, refugee camps, or anywhere with overcrowded environment can be a risk factor for TB. So Kurt, what are your thoughts on TB after all the research we have done today?
Well, before the research, I probably didn't realise it was such a big thing. I was pretty naive. I mean, after the research, we realised that 9 million people are affected worldwide, 2 million people die yearly, and it's just massive. I mean, in Australia, barely anyone you hear of is affected with TB. I suppose it's just because healthcare, vaccinations, policies, the things governments put in place just to keep on top of it and make sure it's not a real issue in developed countries, but in the developing, it's just a real problem for the burden of disease. Yeah, what do you think?
For me, I didn't have a lot of knowledge on TB until we've done this assignment, but now I'm aware that from where I'm from, TB is very present. For instance, I've lived in countries like Ethiopia and Kenya, and within those countries, they have high rates of TB. And after researching and learning about the symptoms of TB, I just realized I was well in the middle of it. Like everyone around me had it, and I'm starting to think, when if somebody passed away from an unknown disease, I'm starting to feel like it could have been TB, because where we were, there wasn't medical facilities
and
or
even education or something, just to let people know the symptoms, how to treat it, how to realise that someone has TB.
Or they wouldn't even know what it was.
Yeah.
Like the doctor might well just be, oh, you're sick, and that's all, you know? So after learning and getting all the facts, I've realized, it's a big problem where I was born. Even though I'm raised here in Australia, it's not a big deal, but up there in Africa, they living with it every day, and their children and their adults are very well affected and of it every day. And it's a struggle there, and it's a very deadly disease. But once if you're here, you don't really see the impact because in this country, like Kurt said, it has been taken care of very well, and there's ways to reduce it and to encourage people to, be diagnosed. So overall, I've learned a lot. Because I can say my knowledge of TB was zero, but now I'm very aware of it. So,
Cool. Thank you.